Good morning. We are now in day 3 of our gradual reopening, and the reports that are coming into my office is that our businesses are following the safe practices guidelines developed by our Department of Public Health. They're continuing to social distance, to wear masks, and put the health of themselves and others as a priority in their daily lives. The gradual reopening is the right way, it's a responsible way, and it's the safest way to get our economy moving again while keeping everyone safe. There are some businesses that will remain closed. We are today, and my staff and the Department of Public Health are meeting with fitness center owners and managers to talk about a path forward for them and a way that they could conduct their business, which employs several thousand people in the St. Louis area, in a way to keep their employees safe and their customers safe. And we hope to find a path forward for them as well. Summer camp guidelines will be out soon. We're working on those. And we expect summer camps to be able to be opened on June 1st. I want to thank the YMCA for working with our staff to produce those guidelines. Our Department of Public Health also tells us that we have a good draft in the works for getting pools open early next month. We're working on those guidelines now, and as those become available, we'll certainly let you know. We know that there are a lot of kids and parents in our community that are waiting and hoping for pools to get open, and as soon as we have those guidelines, we'll have them to you. We expect that those will be open in early June. We have a wonderful and diverse population in St. Louis County and many, many different faiths. We want to remove all of any impediments to worship services in our community, and as of now, different faiths can practice and have services with 25% of the fire code capacity, as long as they are social distancing, and we highly encourage masks. I have heard, however, from several different faiths that they do not intend to start services until the middle of June and will continue video streaming in the near future. I think that's a safe decision, a good decision, and the right decision. We also are working on our CARES Act stimulus grant budget. We expect to have that by Friday. So far, we've spent 16% of that grant on the immediate needs, public health, humanitarian, and economic recovery. We'll continue to work with our county council as we identify those goals, and you can follow along on our transparency portal on the stlcorona.com webpage to find out about those expenses. We're in the spot we are today because everyone in our community has taken seriously our guidelines on social distancing, and we know we can't let down our guard. As a doctor, I know that this virus can spread quickly, and we expect more COVID-19 transmission in our community as we begin to move about more. We understand that we will have more positive tests. We'll be watching those tests very closely. As testing becomes more available, we now know that we can test symptomatic individuals in our community, and in high-risk populations, we can test asymptomatic individuals. There are many, many different groups participating in testing in our community, including our public health department, private labs, health systems, and federally qualified health centers. The state is also sending more tests to the St. Louis region. The road to where we once were is really a ways away. We're just not there yet. We're not to our old normal, we're in a new normal. A vaccine is promising, but we know that it's months away. We have to keep our guard up, we have to be diligent, we have to use common sense to protect ourselves, our loved ones, and even people we meet in shops or at work or in parks. How quickly we overcome this really is up to each of you. I'll be glad to answer your questions.
I know the city's looking at possibly expanding outdoor seating for a lot of restaurants. Is that something that the county could be looking at? And what would that look like if possible?
Yes, I've read some of the things that they were doing to expand outdoor seating. I think that's a fine idea. And for the businesses that are in St. Louis County, we'd certainly consider that. Some of those business licenses are under the determination of municipalities. So a lot of that decision will fall to the municipality where that restaurant is registered. But to the extent that St. Louis County could participate in that, extending their liquor license or extending their outdoor capacity, I'm sure we would be interested.
Do you guys have any numbers just from these first few days about businesses that have been open, how their business has been, how much traffic they've had in there compared to normally?
No, just anecdotal reports. Some have been pretty busy, but we've had widespread report that the businesses are prepared. They're following our social distancing guidelines that have been developed by the Public Health Department. But as far as the percentage of businesses are opening, we just have anecdotal reports. It's really hard to say.
For the summer camps in the pool opening June 1st and early June, is that considered part of phase 1, phase 2? Are we numbering phases or doing phases?
Well, we really, phase 1 is really anything around a small group. I don't know that we would call summer camps phase 2, but it is larger group. It is a little bit of a congregate setting, so it's more of a blend between smaller groups and large groups. And we'll have guidance out for that. Pools is more of a congregate facility, so that's kind of a blend as well. The next step really is probably, after we get past, bars and gyms, probably large banquet centers, and that's more of a clear delineation between phase 2 because it's a larger gathering.
There's been a little back and forth, if you will, when it comes to emergency responders or fire departments, police departments, apparently getting a bill about PPEs from the county. Can you explain that, flesh that out for us?
Yeah, I'm surprised that that's become such a question. The PPE that is purchased by first responders is reimbursed through FEMA at 75%, another federal program. So certainly having it reimbursed through the CARES Act is a possibility, and I've been talking to the municipalities for about a month about making sure that we were able to cover any of their excess expenses, and we'll continue to do that. If we want to have a discussion about not turning that into FEMA, one federal program, and paying it through the federal program that funded the CARES Act, that's certainly something we can consider. And I sent a letter to the Treasury Department to see if that reimbursement would be eligible. Some of the initial guidance we got from the CARES Act, we have to follow that very closely. Some of that initial guidance told us that we could not reimburse expenses that were reimbursable under a different federal program. So we just have to get clarity on that, but we really do not want to see any first responders be stuck with a bill for PPE. And if there's an easier way to do it or a better way to do it, then we'll talk to them about that. And we've been having those conversations.
What about contact tracing and liability when it comes to that? I know that's been kind of a question for some businesses. Contact tracing programs kind of get it up and running. If it's traced back to a business, are they then liable?
Well, liability is a question for the courts. And I'm sure there'll be some liability protection for people who act in good faith, especially if they're following our public health orders. Then that would go into the question of liability, but it's really more of a legal question. But the best liability protection is to just do the right thing, be safe, follow our public health orders, practice social distancing, follow our business guidelines, and do everything possible to keep your employees and your customers safe. And then if I think you're doing that, and the vast majority of businesses will, then I think they'll get the benefit of the doubt if something unusual happens.
Along those lines, any update on the contact tracing program in the county?
We're continuing to hire more individuals. We've caught up on our backlog of contract tracing that was on paper. It's all computerized. It's very efficient. We're working cooperatively with our surrounding jurisdictions. We understand that contact tracing is very important to make sure that we can find individuals who have been exposed, get them the advice and the testing that they need quickly. And if their exposure was significant, then we can even test them. And then regardless, quarantine them if necessary. We're going to be moving past the point of quarantining large populations and just testing them to find out whether or not they're positive so they can move on with their lives. But we do need people to continue to follow the isolation orders and the quarantine orders. And the more people we can get tested, the more folks can move on with their lives without worry.
Last question for me. I know you said the guidelines for the pools and summer camps would be coming out. What could that look like? Would you basically just say pretty much what we've been saying, masks, social distancing, things like that? Just give us a little insight.
Yeah, well, certainly social distancing. I'm not sure about pools with masks.
Right.
I haven't seen those guidelines, but I think we'll have some guidance here in a few days. We want to get the summer camp guidance out. That's really a lot like daycares. I can tell you that the summer camp guidance won't be like normal summer camps. It will be social distancing. It will be common sense. It will be screening employees and kids when they come in. There will be some of the contact sports will be limited because we want to eliminate, we want to be careful with close contact. But some of the sporting events I think will be able to happen. But we'll have those guidelines pretty soon. We're excited about getting the summer camps going again. We know it's a big part of the kids' experience in the summer. It's a big part of the parents' opportunity to have their kids doing something to burn off a little steam. We just want to make sure it's done safely and cautiously and carefully under good supervision and good public health guidance. Any other questions? Doug, anything to you? Anyone? Okay, thank you.